Hello, my name's Dr. Norquist, and today we're going to be talking about the biofilm that's located in the gingival sulcus when a patient has either gingivitis or periodontal disease. Over the last 2 or 3 years, we've been studying different compounds to see if we could kill the bacteria in the plaque that's located in the gingival sulcus. We tried betadine, and we used betadine for many years thinking that it would kill the bacteria. And then we could do a prophy, and if it was bleeding, it wouldn't matter because the bacteria was killed. However, myself and another colleague noticed that when we took a sample of the plaque, that after 2 minutes of betadine in there, that didn't have any effect on the spirochetes, and the spirochetes seemed to be even kind of mad that the betadine was put in there. And a colleague from Seattle found the same thing, and so we tested it and found that betadine has no effect on spirochetes within the biofilm plaque in the gingival sulcus. So based on that, we decided to look at other things. So what we're going to show today is what colloidal silver, 25% bleach, and then we found another compound. It's kind of a combination of herbals and honey, and that seemed to be the most effective in killing spirochetes in gingival sulcus. So here we go. We're going to show you that video and each step along the way. Thanks. Okay, today we're going to be testing a new product. It's a colloidal silver, and what we're going to be doing is using it as a solution, a pre-prophy solution, to see if we can kill the bacteria in the gingival sulcus before we clean someone's teeth. So what we've done is, the first thing we did is we took a plaque sample from a patient, and we have it now mounted on a slide, and we're observing this on a microscope. And what you see is very dense spirochetes. They're long and kind of a loose wind and quite numerous. And so what we're going to do is use a colloidal silver in the same sulcus. We took half the plaque from the sulcus on the lingual part of the second molar in the lower left. And then we're going to put the solution in, leave it in for 2 minutes, and then we're going to have a look at it on the microscope again. Okay. Okay, after 2 minutes of treatment, we see a few of the spirochetes that lack motion, but for the most part, the spirochetes are still moving pretty good. So we're going to put more solution in, let it sit for another 2 minutes, and see if that makes any difference. Okay, even after 5 minutes with the silver colloid, or we didn't see a lot of difference in the amount of spirochetes, and I would say it probably didn't have any effect on these spirochetes at all. So you see with the colloidal silver, even though it was purported to kill everything on contact, that within the biofilm of the gingival plaque within the gingival sulcus, the biofilm is so protective that the colloidal silver cannot penetrate it to begin even touch the bacteria or even show any signs of effect to the bacteria whatsoever. You find that very interesting. So now what we're going to do is trying a concentrated solution of bleach, about a 25%, and then we'll see how that works. And I would say there's some that are laying around dead. So it did have an effect, because there's one laying there completely dead. But some aren't. So I don't know what the deal is on these. They're pretty powerful to be able to withstand straight bleach solution. I think that bleach would kill everything, but to our surprise, when we put the bleach with 25% and we kept it in the gingival sulcus, we put it in with a little cannula, so we got it to the bottom of every pocket and everywhere in the mouth, and then when we took a sample after 2 minutes, we found the same thing that we found with colloidal silver and also with betadine, that it had no effect on the spirochetes within the gingival sulcus. Very surprising finding. Now there's a theory in treating cancer with chemotherapy It's come up. It was developed in Germany, and what they do is they starve the body for glucose or for sugar, and then prior to giving chemotherapy they add a little bit of insulin, so the cells are totally starved for glucose. So what they do is they add glucose in a quarter of the dose of the chemotherapy, and the cancer cells, because they're so starved for sugar, gobble up the sugar along with the chemotherapy and kill the cancer cells. So I was thinking to myself, what if we used honey, which is actually antimicrobial in itself, and there's a Chinese herbal medicine that has several herbal medicines in this honey material that you take for colds or sore throats, and it seems to be very effective. So I tried this in the gingival sulcus, and to my surprise, the honey along with the herbals had the most effect on the spirochetes than bleach, than colloidal silver, or betadine. It had probably 80% kill factor in these bacteria. It's very surprising to see, and I think that this would be a good beginning of research to show that we can actually put something in a gingival sulcus that's all natural, that'll kill the majority of the spirochetes in particular, but the microbials in the gingival sulcus, so that we can go ahead and safely do a prophy without the possibility of having without the possibility of having a bacteremia that we now know is very dangerous to have during a bloody prophy. This is very interesting that we have red blood cells, but you can see how they've been changed by and you can see the color change. It's got a red color. There's a spirochete there, but nowhere near the numbers we had before. Looks like the numbers have been decreased by, 80, 90, 95%. I mean, we still see a few active bugs, but very, very few. It's obviously not 100%, but I would say that there's one right there. Now you can see the color change from what we had before to this dark red. Here's some spore-like forms there. But very little movement. There is some, but very little compared to what we had before. Lots of spore-like forms that you can see now. Obviously, they may reacted and went to the spore-like forms that you can see in this picture here, the little round blurbs. Maybe they reacted so fast to these that they obviously didn't like this solution at all. In this sample we have a couple here that are barely moving, and for the most part are not moving at all. Those are dead spirochetes for the most part. The vast majority of them are just laying there as still as could be. So I find this very interesting, and I think it's very exciting for dentists to be able to use something so that if they do have a bloody prophy, it's not a dangerous thing.